Hi, so my name is Madison Streblow. I graduated from York in the Global Health Program in 2022. So I specialize in health promotion and disease prevention. I completed my practicum at the Caribbean Public Health Agency, so it was based in Trinidad and Tobago, but because of COVID, it was a remote practicum. I was working on the HIV and monitoring and evaluation department. So the CARPHA agency is a bunch of different member states that are all combined together. I think I gained a lot of knowledge regarding the public health targets with HIV. I learned a lot about HIV and what the target indicators were. I also learned about the global goals related to HIV, so what targets we wanted to hit within the next 10, 20 years. So that was really interesting because I think that's not something that's talked about in a lot of my courses, regardless if you talk about HIV or not. I think the biggest challenge was that it was remote. So I didn't get to see my supervisor face-to-face necessarily, but she was really good about having Zoom meetings. So we'd usually check in, and then we'd also just have catch-ups throughout the week. So I think that helped a lot. And then at the end of my practicum, it was really sweet because they had other people in the office and stuff kind of wish me farewell, and we did a little presentation on everything that I worked on. So it was still like a team environment, even though it was through Zoom. I think the most rewarding part was actually the networking at York. I still am friends with so many people from York and in Toronto, and it was just such a great experience to meet so many people. And then from the practicum aspect, I think the most rewarding part was that it really helped drive me and help me direct myself into what I wanted to do in HIV. I enjoyed the public health aspects of HIV, but I do wish in the future to be more with patients. So I think that helped make me those decisions. Coming into York, I had the idea that I wanted to go to medical school, and that still is my plan. But I think the global health program gives me a bit of a different perspective compared to some of the other programs like biomedical sciences. After York, I took a year off, did a gap year, and I worked in an admin position in a plastic surgery clinic. And then I actually decided that I wanted to continue pursuing HIV and STIs. So I completed my Master's of Science in Medicine, and then I specialized in HIV and STIs at the University of Sydney in Australia. So I think it's really important when you go into these practicum meetings is to have an idea of what you want to do and be specific. I know that's not what you want to hear, and it's okay if you have no clue what you want to do because there are so many opportunities. But when I went into my meetings, I knew that I wanted to work in HIV. So I went into these meetings saying I wanted to work in HIV, and then my supervisors were able to help find placements that were related to HIV.